Hey,
I'm here again this week with Bonny Specker, epidemiologist from South Dakota State University, who is going to give us a weekly summary of what has been happening with COVID locally in our state, nationally, and in the world. Bonny, what has happened with COVID-19 in the past week? And what do you have for us today?
thanks, Chelsea. Before I go to that, I just want to apologize for the slide last week in the presentation where I used the world deaths rather than the US deaths. I really don't think it made a difference on the point I was trying to make, but I do appreciate the city posting that corrected slide. But going back to that, just for one small minute, I just want to emphasize that it's really the case fatality rate that gives an idea of the severity of COVID. Right now in the US, about a little bit over 2% of the population has a confirmed history of COVID. In South Dakota, it's a little bit over 1%. If 25% of the populations develop COVID, it's expected in the US that about close to 2.8 million people will die from COVID. In South Dakota, it's estimated that a little over 4,000 deaths will occur. So I just want people to be aware that that's what you need to be looking at rather than the mortality rate.
Well, thank you, Bonny, and I appreciate that. You know, everybody's human, so thank you for sending the corrected slide, and we were happy to get that up for you.
Thank you. So I wanted to also just go over a couple reasons why COVID is really a dangerous virus. First of all, it is a new virus and no one has any prior immunity to it. You know, you look at other coronaviruses that might cause the common cold. A lot of people have a little bit of immunity to that. Their body has seen it before, so it's not going to be as bad. The other thing is that there really are no vaccines as of yet and no drugs that have been shown to prevent the disease. So what you have to end up doing is all the control efforts are really limited to non-pharmaceutical interventions. So that includes isolating cases as soon as they're identified, quarantining contacts, limiting the public gatherings so that people are not spreading it. And as we've all heard, the good personal hygiene, use of disinfectants, social distancing, and the use of face coverings. And I know people are getting really tired of COVID. I'm getting really tired of COVID. We just have to be persistent though, because and remember that it is a potentially very dangerous situation. Worldwide this past week, the new cases per day have decreased actually from 260,000 a day down to 255,000. Not a big decrease, but they do look like they're decreasing. Deaths per day have been fairly constant at about 5,800 deaths per day on average this past week. Nationally, the new cases per day decreased over the last week from 66,000 to 57,000. And there's been a slight decrease in the number of deaths per day from 1,200 down to 1,100. Only 100 difference, but for those 100 families, that's a big difference. The total number of US deaths from COVID is greater than World War I and the Korean War combined. I say that every week because to me that sort of gives it some frame of reference. As far as South Dakota, the number of cases over the last week increased from an average of 81 to 87 per day, and the average number of deaths per day also increased just slightly. There were 607 new cases and 14 new COVID-related deaths in the past week, with totals of 9,371 cases and 144 deaths as of today. The total number of deaths is now greater than the total number of deaths from influenza over the last 3 years combined. So when people say this is just like the flu, this is just like the flu multiplied numerous times. You know, we now have more deaths in South Dakota from COVID than we have from all the last 3 years total. Brookings, it wasn't a very good week. We've had 15 new cases this past week compared to 5 new cases last week, or the week before last. And there's a total of 128 cases, so about a little bit more than 10% of the cases we've gotten in the last week. And we also had the first COVID death that occurred this week. So that's the summary for this week. Do you have any questions from
Yeah. So,
social media?
yeah, I do have some questions, and some questions that have been coming through in the past weeks. And, here when you talk about Brookings, just specify, are you talking about Brookings specifically, or is it the Brookings County area?
This is Brookings County.
Yeah. So a lot of the questions that we've been getting in really relate to that. And people are wondering, when the data is reported, why aren't we giving information on what's specifically happening within the city of Brookings? And, people are wondering, where are those people working? Where have they been? How can I know that information? Who is it? And,
right.
And do you have any information on why, we don't talk about those numbers?
Sure. We do a lot of work with the Department of Health, and you have to be aware that the Department of Health spends a lot of time making sure that the data that they release regarding diseases, regarding survey results, they try very hard to make sure that the data is going to stay anonymous, that people will not be able to identify something that they're reporting about. So say this death, if they said it was in the town of Bruce and it was, a 78-year-old person, well, there might not be that many people in Bruce that are 78 years old. So if they were to give you that information, you would be able to figure out who it was. And so that's an infringement on that person's privacy. So the state, I think, does a really good job of making sure that they don't release enough information to be able to identify an individual. And it all has to do with privacy issues. So I think that's really good. You also have to keep in mind, like if I want to know, well, did that person work at the university or, in my building? I want to know that. What the Department of Health will do is they will actually contact the place of employment. So the place of employment knows, so that they can do what needs to be done to disinfect the area. So also, I think if you look on the Department of Health website, what you'll see is a link. If you go to their COVID website, on the left-hand side is a link that says recent reports. And you can click on that, and it will tell you there if a COVID case has been in a location where other people could be that they can't necessarily identify. For example, when someone comes down with COVID, the Department of Health will talk to them and say, who have you spent more than 15 minutes with over the last period, so many days? And so they'll tell them, all their contacts, and the Department of Health will actually contact those individuals and let them know that they have been exposed. But say I went down to a local bar and the next day I'm diagnosed with COVID. I don't know the names of all those people that are in that bar. So the Department of Health will issue an alert in this recent releases or recent reports that will say this person, a person diagnosed with COVID, was in this location on this date between this and this time. So if you were there, please monitor for symptoms. So they do try to tell you if you need to be monitoring extra careful. You know, if you could have potentially been in a location where someone was that has been exposed. I think it's good though to realize that a large percent of the people who are positive for COVID don't have symptoms. So it's just better to think that everyone could be potentially a COVID case. That's why it's important to wear the masks. It's important to socially distance. Um, and to be careful, you know, to wash your hands and do the things that are recommended. Is that helpful?
It is. So, from what you first said, as far as releasing the information, I know that sometimes we look at other communities and we see that they're, maybe releasing some of that information. So maybe it's just, it really comes down to, our population size, whether or not that information can be shared without being able to get that information.
Right, right.
We do have we have smaller communities in South Dakota than some other areas, and a smaller
You have to have a certain number before they feel that they won't be divulging or enough information to the level that someone might be able to figure out who it was. So Minnehaha County, there's enough people in Minnehaha, enough cases that it's going to be, if they released information on something there, it's going to be harder to figure out exactly who it is. But, they could release race information, they could release age information, but you will never see them release race and age on the same line. Like, they might say this was a white, non-Hispanic person, and it was a person 20 years old. But, they're going to give you more than just one number. They're not going to tell you it was a white person more than 20 years old. Do you know what I mean?
Yeah, they just make sure that they're not releasing the identifying information.
Right, exactly. Or enough information that people could start trying to guess who it is.
And that makes a lot of sense. Well, thank you for bringing some clarity to some of those questions that we've been getting across the board. It really is helpful, Bonnie. Have a great week, and thank you again so much for giving us the update on what's going on with COVID-19.
Sure. And if anyone has questions, send them to Chelsea.
Sounds good.
See you next week.
Talk to you later, Bonnie.
Bye.